EAPs started as a drug and alcohol abuse program in the 50s and 60s. They were a 1-800 number that people can call when they were struggling with an issue. They then ended up distributing through the government, distributing through payers, and ultimately getting in the hands of most of the workforce out there today. Now, the way that the EAP was designed was you basically call this 1-800 number when you're in crisis mode and try to get connected to a counselor on the other side. The problem with this is most EAPs and most health insurance, the national average reimbursement rate for a therapist is $40 to $60 an hour. That is too low for them to make a living after all of the years of school that they go through. So what happens is all the high quality psychotherapists out there say, we're not going to work with EAPs, we're not working with health insurance, we're going to just work on our own in a private practice. So then what happens is those who end up seeing a therapist is really just based on who can afford it, right? It's not based on clinical need, it's based on socioeconomic status and who can pay $250 an hour to see that therapist. So the problem with that model is a misallocation of healthcare spend, and it's inefficient. You might have someone in the green, someone who's doing super well, really just needs help managing stress, but who has the luxury of affording a $250 an hour therapist and seeing a therapist. Then you have someone who really is struggling. They have a severe clinical issue, whether they're dealing with severe depression, bipolar, OCD, anxiety, but who can't afford it at all. So they've got access to no solution. So what Modern Health has done is created a model whereby we have those high quality psychotherapists. We pay them great so they want to be in our network, but we triage people to the right level of care based on their need, which allows us to not only have a much more efficient way to deliver healthcare, but a much more engaging way for the ultimate end user, because we meet them where they're at and we get them the right level of care at the right time.